Okay, so tonight we're going to talk about Chapter 11, and that deals with the muscular system. This is a long chapter. I think there's 203 slides of this chapter. I'm going to primarily focus on how the skeletal muscles move and how they are named, and some other aspects that I think are important. And some of these slides I'm just going to skim through because they're all found in tables and figures in your book, and you will be able to look at those and study them as you need, and become familiar with those. And if a question comes up on the quiz or exam, you should then know what figure you could go to for that. But this is a pretty massive chapter. And one other thing for fun, real quick, I just want to throw out there mus musculus, M-U-S-C-U-L-U-S, mus musculus. Does anybody know what mus musculus is? Well, it's the science name for mouse. I look at the muscular system and I always think of mus musculus. It's just interesting to me because, as you will learn throughout this chapter, that the nomenclature or the naming of the muscular system is based off of things in the skeleton or in the body, or whether it's lateral or medial. I like to play on words, and it just makes me think mus musculus. Anyway, I was trying to have some fun there and lighten it up a little bit. So let's go on to the next slide. We've got a lot of these to get through. So how muscles produce movement. Skeletal muscles produce movements by exerting force on tendons. Tendons attach to and pull on bones, and movement occurs. So this is figure 11.1 on page 345. You see that most muscles cross at least one joint and are attached with articulating bones. So there are some muscles in the body that will cross more than one bone. However, all muscles cross at least one bone. So if we look at the diagram here, or the figure, we see the bicep. It's connected here, and it crosses this entire bone and attaches to this bone. And that's how your arm generates the movement, because your bicep is primarily associated with this adduction. Remember a few chapters ago when we were talking about the movements of the body during the skeletal system? Remember this would be adduction. Abduction moves away. Adduction moves towards. So when a muscle contracts, it draws one articulating bone towards the other. Remember what articulating means, that those are just the bones that are connected to each other. Radius and the ulna articulate with the humerus. And that bicep then helps you to adduct your forearm. So, and this is something that you need to understand here, is that the origin is the attachment to the stationary bone. So when I move my elbow, or when I move my forearm, when I adduct my forearm towards my face, this humerus is staying stationary. All right, so we see here that muscles are connected to bones with what we call tendons. And these tendons, since they are connected to the stationary bone, this is what we call an origin. So this is the origin of the biceps. Insertion, on the other hand, is the attachment to the movable bone. Where the biceps attach to the radius, then we have what we call an insertion. So keep that straight. What's the difference between an origin and an insertion? So a great quiz or exam question. And then also keep in mind that the muscles are attached to bones with what we call tendons. And you can see a tendon here, and you can see tendons here. And as we go through this chapter, and as we get into the nomenclature or naming of the muscles, there are two tendons that are what we call the origin. No pun intended. Part of where the origin of the name of the biceps comes from is because there's two attachments there. And similarly, the triceps, well, can you infer then? Can you deduce from inference that why is the triceps called the triceps? Well, because there's three connections, there's three origins in the triceps, and there's two origins in the biceps. So 3 is tri, 2 is bi, and that's where those names come from. But we'll get to that here in a few slides, or several slides. Just hold that thought for a minute. Let's see what's next. Oh yeah. So this is fun. This is page 347, figure 11.2. Bones serve as levers and joints serve as fulcrums. This is just basic physics here. A lever is a rigid structure that can move around a fixed point called a fulcrum. The lever is acted on by load or some resistance, and the effort would be equated to work. What was this here? The contraction of the biceps brachii is the work or the effort. See, I got something in my hand now, a tape measure. So I'm trying to replicate this figure. I've got this elbow right here, and then my biceps, and then here's the fulcrum. This tape measure represents the load. I'm exerting effort to move this load up or adduct it in anatomical terms, right? This is a great slide. I love these slides because really what we're doing is we're bridging the gap between physics and biology right now. Think about this for a minute. So I've got the biceps, I got the fulcrum, I'm exerting effort. Let's just pretend like this is a brick, all right? And so it would take more effort to adduct this brick. However, in the case of a fulcrum, if I move this load closer to the fulcrum, it becomes easier. It requires less effort to adduct. Okay, so this is an important point, and it's illustrated in your book. You can read your book. So let's talk about the types of levers that we have. We basically have three types of levers, and I'm going to reiterate it that if you've had physics class, then you probably already know this. And if you haven't had physics class, I would recommend taking it. And similarly, if you haven't had physics class and you haven't thought about taking physics class, maybe this would spark your interest in it, because I think this stuff's fascinating. I really like mechanical things, so this really resonates with me, and I would strongly suggest taking physics. Anyway, let's look at figure 11.2 on page 347, and we can see the types of levers. So we've got this thing called a first class lever, and we've got a second class lever, and we've got a third class lever. So I was just illustrating for you the third class lever. So tweezers are an example of a third class lever. On the other hand, scissors are an example of a first class lever. So you see the fulcrum's in the middle, and you have the handles of the scissors. Sorry about that, but just to illustrate my point here. So you've got the handles, you've got the fulcrum, and then you've got the load out here. So if I was going to cut a piece of paper, and if you've ever cut with scissors, and I'm sure that you have, who hasn't cut with scissors? And if you've got kids, I'm sure that kids like to do art projects and to cut out paper dolls or whatever. Most of the time when I cut with scissors, do I have something I can cut? I got some junk mail here. So let's just see experimentally. So this is an envelope that I haven't opened yet. And there's no card in here or anything. Junk mail drives me crazy, so I'm glad to cut it up. But when I have it out towards the end of the scissors, it's very hard to cut. I'm not saying I can't cut it, but it is harder to cut. So if I really wanted to get some force on that, I could move the paper closer to the fulcrum. And wow, that is so much easier to cut. So you can try that yourself at home with scissors. And then they use a wheelbarrow for an example of a second class lever. And you can see the fulcrum and where the load is located, and then the effort is the handles there. And wheelbarrows are very handy, good tool to have around the house. All three of those levers are good tools to have around the house. So I bet you never thought of scissors as a lever before. Well, maybe you did if you took physics. Bet you never thought of tweezers as a lever. A wheelbarrow? Do you have a wheelbarrow at your house? If not, you should get one. I bet you got scissors and tweezers. Get a wheelbarrow too. Then you got all three levers. So the effects of fascicle arrangement. Muscle fibers are arranged in parallel bundles within fascicles, but the arrangement of the fasciculi in relation to the tendon can vary. Fascicular arrangement is correlated with One, the amount of power a muscle can produce, and secondly, the range of motion. So this is going to be table 11.1 on page 348. So these are just the arrangement of the fascicles, and I think this is important for us to learn. So let's look at these a little bit. We got the parallel fascicles, which just means that the muscle fibers are running parallel to one another. And then the fusiform, similar to parallel, but you notice how it kind of goes in that ellipse shape. So technically they're not parallel, but they're closer to parallel than perpendicular. Ellipse is not parallel, but circular muscles, this is mostly your sphincters. You have sphincters in your eyes, looking my eyes, in your mouth, your anus. In the digestive tract, there's a sphincter in between the stomach and the small intestine, and there's a sphincter between the stomach and the esophagus. So the sphincters in there are voluntary in your digestive system. So we're not necessarily covering those tonight. The smooth muscle and the cardiac muscle will be covered in later chapters. Tonight's lecture primarily focuses on skeletal muscles. The sphincters, those are just circular muscles. We also have triangular muscles. So muscles that kind of go up to a point. The pinnate group. So this is a group of muscles, and we can see the unipinnate on the left, and then in the center we've got the bipinnate. And then on the right, we have the multipinnate. I guess the thing about this is, see how there's this tendon here, and then these muscles are going into this diagonal, I guess for lack of a better term, grain. See how they kind of go diagonally into that, into the tendon. So pinnate, it's something that you would, that is a word that you would encounter if you took the subject botany, because leaves can be pinnate or bipinnate. So that's why I always like this slide too, because it kind of reminds me of botany a little bit. So coordination within muscle groups. Most muscle movements are coordinated by several skeletal muscles acting in groups rather than individually, and most skeletal muscles are arranged in opposing pairs at joints. So the prime mover is what we call the agonist. And then we have the antagonist, which is in my elbow. The biceps is going to be the prime mover. The antagonist is my forearm, or my radius and ulna. And then synergists, as you can probably infer by the language there, the word, those are muscles that work in concert together. So some muscles, they work together to exert effort. The naming of skeletal muscles, or nomenclature, and this starts on page 351, and we'll be looking at page 352, table 11.2, but any muscle can be named based upon location, size, number of origins, appearance, direction of fibers, origin and insertion, muscle action. So like biceps brachii. Well, remember what I said a few slides ago, that the reason it's called biceps brachii is because it has two origins. Triceps brachii, it's three origins. So there's a number of ways that they name muscles, and you can see all of these here on the table I mentioned, 11.2. The orientation of muscle fascicles relative to the body's midline. So this shows you that if you see a muscle that's called a rectus, rectus just means it's parallel to the midline. So that doesn't mean that it's on the midline. It doesn't have to be on the midline. Don't get me wrong. It's parallel to the midline. So that's very important to understand, is that parallel is when two lines travel in space, and they travel in such a way that they will never touch each other. Transverse are perpendicular to the midline, and perpendicular means like a right angle, 90 degrees, or a T. That's perpendicular. Oblique, diagonal to the midline. So that means that the muscle is going to move diagonal to your midline. And that just reminds me of another important thing I forgot to mention at the beginning, is that The muscles are really, remember we have the axial skeleton and then we have the appendicular skeleton. Axial muscles are going to be related to the midline or the center of the body. They're going to work with the axial skeleton, and then the appendicular muscles work on the appendages of your body. And then, of course, we'll see here in several slides down the road here, but the pectoral girdle here, how do the muscles of the appendicular skeleton connect to the muscles of the axial skeleton? You see there the direction that may lead to the name, so very important stuff to learn. And then, of course, the size of the muscles, so maximus, minimus, largest, smallest, longest, brevis. I mean, this is a laundry list of stuff. And if you can memorize all of these, I tend to err on the side of just understanding how they work and understanding the language. Gluteus maximus. So it just would infer then that just by the language, and that's true for much of biology, is that it's mostly based off of Latin and Greek words. And you can look at those words and you can understand then what part of the body it is, and you understand that gluteus maximus is the larger muscle than the gluteus minimus. Language is so important, and it's very important in biology, and when we get into nomenclature like this, it even becomes more important. So the relative shape of muscle is another way that we name muscles. See there the trapezius, trapezoid, serratus, sawtooth, rhomboid, diamond shape, orbicularis, circular, cularis, cularis. Get it? Principal action of the muscle, so flexor, extensor, abduct, adduct. You already know most of these words from the part of the course that we learned at the beginning where we talked about the anatomical positions and all that stuff. So we talked about how things move. Remember supinate and pronate? We should already know all of those terms. And then if you can just remember those terms and apply them when you see the name of a muscle, like when you see the words extensor carpi ulnaris, well, increases joint angle. Ulnar, ulnaris, where's the ulnar at? Do you know? The ulnar is in your forearm. Extensor, so it extends the ulnar some way, somehow. And that's, as I said, increases joint angle. All right, so language is so important, especially at this point in your biology learning. It's so important. I already talked about this concept: biceps, triceps, quadriceps. That's the number of origins. Location and structure, and then sites where the muscle originates and inserts. And all of that's on table 11.2 on page 352. So this is a nice figure here, and this is, yeah, we're going to backtrack a little bit in the chapter, and we're going to go to page 349 and also 350. And this is figure 11.3 on both pages. But you can see here is a human form in anatomical position. It looks androgynous. I don't see any sex organs on this, so this is just basic muscular anatomy of the body. All right, and these would also be, what would they be? They would be the superficial muscles, because we can see, in other words, we're not really seeing the deep muscles, so they're at certain points of the body, there's probably some muscles deep, more internal than the ones that we're seeing on this view here. So here we're looking at the anterior view, and here we're looking at the posterior view in anatomical position. And just one other thing I should point out is that the white parts, those represent tendons, and sometimes they represent what we call a sheath. So some of the muscles have a sheath on them, just for added protection. Well, let's talk about the muscles of the face now. We talked about how they're named and overview of the muscles. We're going to talk about muscles of the face. The muscles of the facial expressions lie within the subcutaneous layer, originating in the fascia or bones of the skull and inserting into the skin. Interesting. When these muscles contract, they move the skin rather than the joint. So most of your muscles of the face are moving skin instead of joints. So that's a little bit different than what we've been talking about so far. And this is why your face has such a wide range of facial expressions. I can express anger or happiness, or I can be sad based on my facial expression. And those are a result of the muscles making my face shaped differently, and therefore conveying to you an emotion I may be feeling or may not. If I'm an actor, I may be feeling one emotion, but telling you that I'm feeling another, right? Actors do it all the time. So this is figure 11.4, and this starts on page 354 and goes on to 355. So you can see there's so many muscles in the body, and you can see all of these muscles. Now, one thing I should say about the facial muscles and the muscles of the skull is that they're often named for the bone that they are going to originate with, right? So temporalis. Remember your temporal bone? When we did the skeletal system, your temporal bone was right here. Your frontal bone was here, your parietals. So look at this, occipitofrontalis, right? So this just means that it's part of your frontal bone. Masseter. Well, that has to do with your chewing, and we're going to get into that a little bit. But you can go through this figure and study the bones. And then we got this table here on page. But anyway, page 356, there's a table there. But you can see here that it goes through the origin, so where it connects, where the stationary bone is that it connects to. Its insertion, where it connects to something that it moves. Its action, so what it does. And then innervation. And all the innervation means how the nerves work there or what nerve is there. Like we can see here, facial 8 nerve. So this is a nerve. So well, obviously this one doesn't seem like it has a nerve. You remember from basic biology, did you do the experiment where you got with the partner in lab and you took a couple of pins or needles or some kind of pokey device, and I got a couple of pins here. So you would like figure out how many millimeters or centimeters that you could feel 2 points. So in the hand, there's way more nerves in the hand. So I can put these things closer together and still feel 2 points. But if I get to my arm, I can get these things closer together and only feel 1 point. And at what point do you feel 2 points? So that's a good indication of how you have different nerves and how your muscles are innervated, the nerves that are related to that muscle. So again, go through this table. Muscles of the eyeballs. So the muscles that move the eyeballs are called extrinsic eye muscles because they originate in orbit and insert on the sclera. There are 3 pairs of extrinsic eye muscles, superior and inferior recti. Remember what recti means? Rectus. So that's going to be parallel to the midline. And remember superior and inferior, higher or lower. Lateral and medial recti. Lateral means more to the left or the right. Medial means more towards the center. Recti, again, means parallel. Somehow it's parallel to the midline of your body. And then the superior or inferior obliques. And this is figure 11.5 on page 357. Muscles of the upper eyelids. The tendon of the levator palpebrae superiosus passes the eyeball and inserts into the upper eyelid. The point of insertion allows it to raise the eyelid. And these are some of the fastest muscles in your body. These eyelid muscles that you have, some of your fastest muscles that you have. And you can see here, this is once again part of figure 11.5 over there on page 357. And then this table you find on page 358. This is part of table 11.2, it has to be. Because why else would they have all these tables without numbers? Anyway, so you can see here the muscle of the upper eyelids, and again, these tables are going to outline for you the muscle, the origin, the insertion, the action, and then the innervation. All right, this is a very useful table. This is a huge table. This is a long chapter, so I'm going to kind of skim through some of this stuff. If you have any questions or if there's something you want to look at more closely, feel free to raise your hand or to say something, because all I can see is PowerPoint right now, so I might not be able to see it if you raise your hand, but you can certainly speak up. Muscles that move the mandible and assist in mastication and speech. All that mastication is a fancy word for chewing. Muscles that move the mandible are known as the muscles of mastication. So the mandible is the only movable joint in your skull. It's your lower jaw, and it deals with chewing. And of course, getting back to the lever, if you have a piece of hard candy, you got one of those little peppermints, right, or a candy cane that you get at Christmas, and you put it out here in the front of your teeth, and you try to bite it. Probably might not be able to bite it, or you might get hurt if you do. But if you put it more towards the back of your mouth and really bite down on it, you can bite into the hard candy like that. So this is figure 11.6 on page 360. And this just shows the muscles of mastication, or the muscles that you use for chewing. And again, that same table that I referenced earlier, muscles that move the tongue and assist in mastication and speech. Page 362 now. The tongue is a highly mobile structure that plays a critical role in mastication, taste, and swallowing, not to mention talking. The tongue is attached to the mandible, styloid process of the temporal bone, and the hyoid bone. So we can see it illustrated here. Figures. This is not seeing this. Oh, yeah. 11.7 on page 361. Again, the same table that we've been talking about with all of the different muscle origin, insertion, action, and innervation. Very useful stuff. Let you study that on your own. Muscles of the neck starts on page 362. Suprahyoid muscles elevate the hyoid bone, floor of the oral cavity, and tongue during swallowing. Most of the infrahyoid muscles depress the hyoid bone and move the larynx. Page 362, figure 11.8. Same table we've been talking about. Muscles that move the head. Page 364, figure 11.9. Look at how complex this is back here. You've got all these muscles that allow you to move your head. This is figure 11.9 on page 365. The table again. So the abdomen that protect the viscera and move the vertebral column. Page 366. Anterolateral abdominal wall is composed of skin, fascia, and 4 pairs of muscles. So here's a view of the abdomen, and this is outlined for you on page 368, figure 11.10. So you can see the shape of the pec, the pectoralis major. See, I would say that's kind of a triangular shape. Here's your delt. See, there's a little bit of a sheath here that covers your rectus abdominis. So remember what rectus means. It just means that it's parallel to the midline of the body. So here's basically the midline right here. And notice the striations on these muscles. They're parallel. So that's why we call it rectus abdominis, because rectus means parallel to the midline. All right. And this is just figure 11.10 continued. And then here is 11.10 continued too, but this is on page 369. So this is actually a cadaver, so you can kind of see this in what it might look like if you were doing an autopsy or if you were in a cadaver lab. And the table, we'll just kind of skim through this real quick. Muscles of the thorax that assist in breathing. Breathing, very important stuff. Muscles of the thorax alter the size of the thoracic cavity so that breathing can occur. And again, here is figure 11.11 on page 370. So you can see this cavity that expands and contracts. These muscles, when they expand, they allow you to take in air. When they contract, they help you to force out air out of your lungs. The diaphragm. So the diaphragm separates the thoracic cavity from the abdominal cavity. So that's an important distinction there. This is kind of the dividing line. It's like the border, right? It's the border between the thoracic cavity and the abdominal cavity. And this is continued on page 371, just more of the same but different views. And the table again. Muscles of the pelvic floor that support the pelvic viscera and function as sphincters. This begins on page 372. The group of muscles and associated fascia is called the pelvic diaphragm, stretching from the pubis to the coccyx and from one lateral wall of the pelvis to the other. So here we see the muscles of the pelvic floor, figure 11.12, and this is female here, and you can tell that because of the opening here called the vagina. But you can see that there's a number of muscles that go around this that make up the pelvic floor. So now we're getting into a little bit, they're the same muscles, but the arrangement between the sexes is a little bit different. In other words, the male anatomy in this area versus the female anatomy in this area is significantly different. And one of the things that I'd like to point out is that unlike the male, the female has this opening here that goes into the pelvic floor. So it's just one of the many differences of males and females here. The table here again. Now we're going to talk about the muscles of the perineum, and that starts on page 374. Perineum is the region of the trunk inferior to the pelvic diaphragm. It's diamond-shaped and extends from the pubic symphysis to the coccyx and the ischiotuberosities. I was trying to contrast these two because this is male. I guess maybe part of the thing is that we don't really talk about the pelvic floor the same way we do in the male versus the female, because there are such significant differences here, but we can certainly contrast those. And we can see that obviously there's no vagina here, but there are some muscles that go up and they help with erections and sexual arousal for the male. Now, again, the penis is not a muscle, but it is supplemented by muscles. All right, much like the vagina, which is surrounded by muscles, where when she becomes sexually aroused, those muscles are going to fill with blood and they're going to expand and make that opening a little bit smaller. And then again, the table that we've been referencing here. Muscles of the thorax that move the pectoral girdle. And this starts on page 375. And remember, the pectoral girdle is how the axial skeleton and the appendicular skeleton are articulated or are connecting together. So this is figure 11.14 on page 377. So you can see here how the appendicular skeleton is connected to the axial skeleton and how these muscles allow for movement, either whether it's adduction or abduction or rotation, but all these muscles are going to work together. So you can see here that this pectoralis minor, look at this. So I guess we could have called this try something because it has 3 origins. Okay, so this is going to be figure 11.15 over on page 381. And then, of course, our table. It is a theme throughout this whole chapter. I'll let you study that on your own. And then the muscles of the thorax and shoulder. So I gotta go back. Figure 11.15 on page 379. So that's kind of what I was talking about earlier. Let's go back a few slides here and have a look. So these muscles here that we're looking at on this figure, these muscles are what we would call deep. On the other hand, these muscles here are what we would call more superficial. So literally in your body, you have layers of muscle. Page 380, figure 11.15. This is just a posterior view of the thorax and the shoulders. The table again. Muscles of the arm that move the radius and ulna. Page 382. And this is figure 11.16 on page 383. So now we're kind of getting into the appendicular skeleton. And we've already talked about the humerus a little bit in the introduction to this chapter. So here we have another view of that, and that's on page 384 at figure 11.16. And this is page 385 and 384 and 385. So this is a continuation of 11.16. So you can see all the different muscles that you have in your arm. Brachialis. You have a number of different muscles that do little different things for your arm. The arms are very useful. I don't want to call them tools, but a very useful part of your body that you can do a lot of stuff with. Muscles of the forearm that move the wrist, hand, thumb, and digits. Page 385, and then going on to figure 11.17, page 387. So look at how complex this gets. In your hand, then, you have muscles that, for lack of a better term, clumsy, and then you have, but strong. They're strong, but they don't have like the fine motor skills that or movements that you might have. So those are what we would refer to as external muscles of the hand. And then you've got these intrinsic muscles of the hand that allow you to do the fine movements that are going to allow you to play a violin or going to allow you to write a paragraph or a sentence or something. This is just more of the same. It continued on page 388, 11.17. Page 389, 11.17 continued. So we're just looking at a transverse plane of the hand there. And so these are actually nerves, many more nerves in your hands than you might have up near your shoulder. That's because your hands, they're more sensitive. They have to be. Just think about it for a minute. What do you do with your hands in a day? You do so much stuff with your hands, if you're lucky enough to have hands. The table again, study that, just go through it, become familiar with it. Muscles of the palm that move the digits, intrinsic hand muscles. So the intrinsic hand muscles, and this starts on page 391, but these are the muscles that are going to give you those fine motor movements that you have in your hand that are going to allow you to play a violin or write a paper, write with your hand, or type even. But you can see there, figure 11.18 on page 393. Same figure there. Yeah, this continues on page 394. This is figure 11.18. So you can see all these little muscles that you have. And like I said before, you know, all muscles, they span at least 2 bones. So you can see here, you got the tendons, you've got this muscle, and you've got another tendon connecting it here. Intrinsic hand muscles. And then here are just all of the ways that you can move your hand. So you can see opposition. Looks like sign language to me. And that's also at page 394, figure 11.18. Table again. Muscles that move the back. Muscles of the neck and back that move the vertebral column. Page 397, figure 11.19. So you can see that these muscles are what we would consider deep, but these muscles here, these are superficial to these muscles, which are deep. So these are going to help you to move, not only move, but also support your posture. They might not be as movable as like you might have here in your arm, but what they do is they're under constant load, and because they're helping that spinal column to stay straight and helping you to have an upright posture and help you to be able to bend over or bend backward or whatever you need to do. Page 398, figure 11.19. So you can kind of see here how they are connecting to the spinal column and then the ribs. Muscles of the gluteal region that move the femur. Here we're at page 401, figure 11.20. So the femur is the largest bone in the body. Remember that from the skeletal system. And then the gluteal region, that's going to be like your buttocks in that area. So page 402, figure 11.20. This part of your body, this gluteal region that help to move the femur, these are some of the largest muscles in your body. And they're some of the strongest muscles in your body as well. Because think about it, like I was just saying about the muscles of the neck and the spine that help your posture, but these muscles, they actually help you to walk and to run, and when you stand, they're really supporting your weight. And this is just continued on to page 403, same figure, 11.20. And then our table, of course, where you can see all the different muscles and their innervation and other interesting information on the muscular system. Muscles of the thigh that move the femur, tibia, and fibula. Page 404. Page 405, figure 11.21. So this is a transverse plane, so we're basically looking down at the leg, and you can see here that you've got innervation going on here, you've got skeletal system, and then you've got these muscles. And look at this, biceps femoris. So not only do you have a bicep here in your arm, but you also have a biceps in your leg. So remember what that means. It's just two origins. In the nomenclature, if you see biceps, you know that that's two origins. Back to our table for you to study on your own time. A great overview of the muscular system. You'll learn a lot if you read it. Muscles of the leg that move the foot and toes, page 406. Page 407, figure 11.22. So you can kind of see the leg there and all of the muscles that make up it. And then we'll get here into the foot here pretty soon, but this is a posterior view of the leg right here. And this is a posterior view deep, so that just means that these muscles are superficial, so they're more on the outside, and these are more on the inside. And then you can go on to page 409. Oh, this is 11.22, so this figure is part of 11.22, page 408, 11.22 continued, page 409. So you can see kind of all of the deep views here of each of the muscles that make up your leg, the lower part of your leg, I should say, in the interior compartment of the leg. So back to the table with much useful information. Intrinsic muscles of the foot that move the toes. So this starts on page 411. And this is figure 11.23 on page 413. But you can see here, much like the hand, the foot also has external muscles and then the intrinsic muscles. So remember, the external muscles are just going to be the gross, the big, clumsy muscles that, I hate to use the word clumsy, but compared to the intrinsic muscles, they are clumsy because the intrinsic muscles give you much finer movement, much finer technique. So, for instance, put it into context. If you were a ballet dancer, you would probably have very strong intrinsic muscles in your feet because you will have developed those through that dancing. So just getting into the intrinsic muscles of the foot here. Oh, this is 11.23 continues, so we're still on page 413. But you can see the muscles, so it's similar. The foot is similar to the hand, but it's not, obviously, because one of the things that the hand has that the foot doesn't is the opposing thumb. Remember that one figure where commented it sounded like sign language? You can't move your foot like this, and I'm not going to take off my shoes and socks to show you my foot, but just do it with your own foot. Try to do that with your big toe and your little toe. You can't do it. You don't have the range of motion with your foot, but you do have some intrinsic muscles that can give you fine movements in your foot. I remember when I was a kid, I used to try to write with my foot. I was developing those intrinsic muscles. I don't do that anymore, but when you're a kid, you got a lot of time to do fun stuff like that. Back to our table. So now we're going to talk about some of the disorders that may be related with the muscular system. So most running injuries involve the knee. Running injuries are usually related to faulty training techniques. Running injuries can be treated with Price. Talked about Price in a previous chapter. Protection. Oh, maybe we did. Rice. Ice. Compression. Elevation. I'm not sure what they would use the rice for. Would you eat it? No, it's supposed to be rest. I'm looking at the book. Rest. Oh my gosh. So I've already told you guys this, but I get these PowerPoints from the publisher, and sometimes they have typos in them, and there's a typo for you. And I'm thinking, do you eat the rice or do you put your foot in it? Anyway, rice should be rest. So Price, protection, rest, ice, compression, and elevation. And then you've got these injections, cortisone. They can help. I've known people who have had cortisone injections, and I don't think I would recommend that. And if I was a physician or a nurse practitioner or something of that nature, that would be last resort, because it's like a drug. I've known people who've had to have those, and it seems like they need more and more and more of them. It works for a time, but then after it wears off, you need more, and then as you go on, you build up a tolerance for that, so your injections become less effective. And then, of course, rehabilitation or physical therapy can help with that. But I guess getting back to it, I mean, preventative maintenance, right? Faulty training. So if you're into running, get the proper training. If you're on the track team or whatever, where you run. If you're running on the sidewalk, there's more impact on that concrete than there would be on asphalt, or that there would be in grass. Because I've done some running in my time. I used to be on the track team. I always like to run in grass, especially tall grass, because I always thought it gave your leg muscles better training, because not only are you minimizing the impact every time you take a step and you're hitting that concrete, or you're hitting the ground, whatever you want to call it. If you go out in grass or on the dirt and do it, there's less impact there because it's softer. But if you throw in grass or tall grass, then you're also getting some resistance to your stride. Therefore, you're getting a better workout, in my opinion. Of course, when you run, I always felt like I ran differently on asphalt than I would in grass, and I ran differently on concrete. So, the surface that you're running on, the training and understanding technique, understanding how to run, how your muscles work, which is what this chapter is all about, will help you not only to be a better athlete, faster runner, but will help you to have more longevity with our sport, or whatever it is we choose to do in life. We always want optimum longevity with that. We don't want to have to retire early because we got a knee injury. At least I don't. Maybe some people do, but personally I don't. Anyway, compartment syndrome. Pressure constricts the structures within a compartment, resulting in damaged blood vessel. And if this is left untreated, nerves can suffer damage, and muscles can develop scar tissue, and contracture may result. And then plantar fasciitis. This is a painful condition that results from chronic irritation of the plantar aponeurosis at its origin of the calcaneus. So this calcaneus is in the heel. So this is when you have pain in your heel, in your foot, that could be this disorder. Treatment includes heat, ice, stretching, weight loss, prosthetics, steroids, and or surgery. So there's options there. Anyway, class, that concludes this chapter.